Lung cancer is the most common cause of cancer death in the United States. It's not widely known, but more people die of lung cancer than die of breast cancer, prostate cancer, and colon cancer combined. The biggest risk factor for lung cancer is clearly a history of smoking. Most people who have lung cancer nowadays in this country are actually former smokers. Based on the results of the National Lung Screening Study, we found that for every 300 people that are screened with a low-dose chest CT for lung cancer, one life will be saved. To put that number in context, approximately 700 to 800 women will need to have a mammogram performed in order to save one life. In addition, we can compare that to colonoscopy, where for every 1,200 to 1,300 colonoscopies that are performed, one life will be saved. Based on the results of the National Lung Screening Trial, we feel that there's very firm scientific evidence that this should be offered to patients as a beneficial procedure. We feel that it's important enough to offer this that we're going to offer it as a free service until such time as insurances adopt this as part of their reimbursed care. The types of patients who would be eligible for the lung screening study fall into primarily two groups. The first group are patients aged 50 to 74 with a significant history of smoking. We characterize a significant history of smoking as being greater than 30 pack years, which is to say 1 pack per day of smoking times 30 years. The second group is a slightly larger group where there's less of a history of smoking, over 20 pack years, but in conjunction with that smoking history, either a history in their person of having had a previous cancer, like a skin cancer, or having had a family member who's had lung cancer in the past. In addition, anybody who's been exposed to significant occupational inhalational pathogens such as asbestos would fall into that second group. For primary care physicians and patients who have questions about the lung screening program at Midstate, the number to call is 203-694-8631. That number will put you directly in contact with the navigator who oversees the lung screening program.